Good afternoon. I'm Dr. Jim Powers, and on behalf of the Tennessee Coalition for Better Aging, I'm pleased to welcome you to today's webinar. The Coalition for Better Aging is made up of many organizations across the state, working together to ensure the well-being of older adults and family caregivers. And for the past 2 years, we've been convening conversations and engaging state leaders about ways to improve Tennessee's long-term services and supports. As a physician provider myself, I know how important these services are to older adults and to families in our state. Today, we're pleased to continue that work by partnering with Nashville Public Television to show the Aging Matters Reimagining Long-Term Care segment and invite several panelists to share their expertise and insights. Following the panel presentations, we'll have a time for a few questions, and we encourage you to submit them by clicking on the questions icon at the bottom of your Zoom screen. You can also share comments in the chat. I'd like to remind all that this session is being recorded. At this time, we are going to screen Nashville Public Television's recent documentary from their Aging Matters series, Reimagining Long-Term Care. By 2030, 1 in 5 U.S. residents will reach retirement age, and a majority will need some form of long-term care during their lifetime. But the high cost of care and a shortage of caregivers are leaving older adults and their families with few places to turn. How we address the caregiving crisis today will determine our quality of life in the years ahead.
One of the big reasons why we're stuck with the long-term care system we have is a very widespread belief that it can't be any better than it is.
I wish policymakers would really sit down and talk to families like us, really listen to what we're saying. We need help, when we need somebody to advocate for us.
Many seniors who cannot access services lose a sense of purpose.
Loneliness brings you down. It messes with your whole health system, causes stress, anxiety, panic.
We have to start paying attention to human need and put money in places and in services that address human need, not just throw away certain populations.
The United States faces a rapidly aging population. We and our loved ones are living longer on average, yet we're not always living healthier. 60% of older adults have at least 2 chronic conditions. Over time, that can increase the need for costly long-term care. In fact, 70% of us will need long-term care at some point during our lives. Yet a majority say they've done little to no planning. Family caregivers are often left to shoulder a majority of that burden. Yet Tennessee ranks 49th for support of family caregivers and 43rd in delivery of long-term care services. Hi, I'm Kathy Matea, and on this edition of Aging Matters, we're going to look at the long-term services and supports that exist today while reimagining the long-term care of tomorrow. Stay tuned.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.
Okay, so take out Sunday. Okay, yeah, take out. As a professional in long-term services and support for decades, I had absolutely underestimated what's required of a family member in a supportive and caregiving role. You want to go ahead and set up for next week? I had absolutely no idea of how complex that family caregiving role was and how it impacted an individual's entire life.
Vicki Harris launched her professional career as a nursing home administrator, and prior to becoming a family caregiver, she spent decades working in long-term services and supports, a field that benefits by some explanation.
One of the first things that people need to understand that when we talk about long-term services and support, it is not just nursing homes by any means. There are really three major categories. One is the facility base, which are nursing facilities. And then we have what we call community-based services. Those are your adult daycares, your assisted living facilities. And then the third is home, which is what everyone is migrating toward these days. And those are the personal care aides that come in and help with bathing and dressing.
Despite Harris's vast knowledge of long-term services and supports, it wasn't until her own parents began needing care that she realized how few resources are actually available.
There is a huge deficit around that middle income bracket as far as funding and programs available to meet their needs. So what we have is people having to shift that burden to their family, the family taking on that responsibility. There was a point where I was simply overwhelmed, and certainly I had what I consider to be a well-sourced library of knowledge on long-term services and support, as well as a network of folks that I could call and ask questions, and was very familiar with how the system worked. But it moved me from being a professional to being a daughter with the emotions, but still needing to make sure that their needs are being met. One evening, driving back from Lewisburg, I actually concluded that no one knew how challenged I was and that I was the equivalent of a tree falling in a forest and no one knew.
Here in the United States, nearly 1 in 5 people are unpaid family caregivers, and they're providing 80% of long-term care at home. That unpaid care comes at a cost. In 2017, most family caregivers spent an average of $7,000 out of pocket, and that doesn't account for thousands in lost wages from missed work.
We fail family caregivers because we don't provide enough supports that allow them to remain viable in the community as they were and a contributing member of the community because of the time that is associated with the family caregiving role. And so we see chronic conditions become a problem or exacerbated, or new conditions are identified as a result of the stress and the lack of sleep that goes with family caregiving.
Like Harris, many families are unprepared for the real cost of long-term care, and some assume that Medicare will pick up the tab, but according to Grace Smith with AgeWell Tennessee, that's largely false.
There are two things that I think are important to keep in mind as we talk about paying for long-term care. One is the misperception that Medicare covers long-term care expenses. It covers some expenses on a limited basis. For example, nursing home care for rehab after a fall or hip replacement surgery. Limited care for a limited amount of time.
While some Medicare Advantage plans are now offering a limited variety of supplemental home and community-based services, traditional Medicare does not cover long-term services and supports.
There are basically three main ways you can cover those costs. It's private pay, long-term care insurance, but only 7% of people 50 and older have long-term care insurance. And then there are state Medicaid programs, which you basically have to spend down your resources and qualify medically to be covered by Medicaid. And for the majority of us, we're not going to qualify for Medicaid.
In Tennessee, Medicaid is provided through TennCare, Tennessee's managed Medicaid agency. For older adults in need of long-term services and supports, there's the Choices program, which covers both nursing facilities and home and community-based services. But to qualify, a person needs to meet both the medical and the financial criteria.
Good. In Tennessee, it's rather difficult to become eligible for Medicaid services because the bar is pretty high and the income is pretty low. You have to be eligible for nursing home placement to be eligible for the Choices program. And then you have to have a very low income to qualify on the financial side of Medicaid. And low income is defined as not having more than $2,000 in assets.
For many, the cost of long-term care can come as a shock.
It's staggering to see statistics that the average cost to someone needing long-term care is around $266,000, and at least half of that is going to be out-of-pocket cost. Contrast that to the fact that the majority of families, the average household savings for retirement is $10,000. People are not retiring with enough money to pay for long-term care, and that is a huge issue that's going to drive more people to try to qualify for Medicaid.
One potential solution has been Tennessee's Options for Community Living program.
The idea behind Options was if we can offer people a basic level of support, such as homemaker services, such as meals delivered to the home, such as transportation, they're going to be happier, and it's also going to save the state money. The problem is that there are more people on a waiting list for the Options program than there are being served, and state funding for that program has not kept pace with the demand.
While a majority of Americans over 50 would like to remain in their homes as long as possible, fewer than half believe that will be achievable. For Harris, the deficits in long-term care have been a sobering reality, personally and professionally.
You know, what's been so revealing for me is that it is the middle class. People like my parents who worked hard all their life, didn't shirk, certainly did not waste, who are falling through the cracks. And then there are individuals like me who are in that role of providing supportive and caregiving services, who are the trees falling through the forest. And guess what? Our health and well-being is being impacted. That has a future negative impact as we continue to age.
It's an issue that hits close to home for Jimmy and Velma Jackson. At 63, Mr. Jackson hadn't foreseen a future where he'd need long-term services and support so early, and he and his wife were unprepared to meet the challenges ahead.
Well, I appear to be having difficulty on my end too. I apologize.
I think what we'll need to do at this point, and again, I apologize, we did not anticipate an internet issue while we were playing the segment, but what I'd like to do is go ahead and move forward with our panel discussion. Again, I'm sorry to have to cut short the Aging Matters segment. But we will move forward with our panel discussion. And Shawn, I'm glad that you are first up on our panel, particularly as producer of this segment. We encourage everyone to watch the Reimagining Long-Term Care in its entirety at the WNPT website. Each of these segments is excellent. And what I love about this one is Shawn, as the producer, took a very complex subject and really brought it to life through the stories of the caregivers, families, and also highlighting some innovative models. So, Shawn, I'd like to introduce you first, and then we're just going to have a conversation about some of the insights and things that struck you as you produced the Aging Matters segment. And then following our conversation, I'm going to introduce our other panelist. I'm Grace Smith, Executive Director of Age Well Middle Tennessee. I also have the pleasure of being the co-chair of the Tennessee Coalition for Better Aging with Dr. Powers. We wanted to, following the Aging Matters segment, have a panel conversation where you could hear directly from Shawn, who produced this segment, also from Lance Iverson from the Tennessee Comptroller's office, who will share their recently updated long-term care report with some important updates about some new investments that the state is making. Then we'll have Amy Harris, a family caregiver, sharing her personal story and perspective. And then we'll wrap up our panel with Mia McNeil, the director of AARP Tennessee. So thank you to all of our panelists. And Shawn, now I'm going to introduce you. Shawn is the content and engagement producer with Nashville Public Television. His work includes numerous documentaries in both The Next Door Neighbors as well as the Aging Matters series. His most recent show was Aging Matters, Reimagining Long-Term Care. So again, Shawn, thank you so much for joining us today. And again, my apologies that we had an issue in showing the full segment.
No, thank you so much, Grace. And I think we're all kind of used to that by now, but please do, I hope that you are able to go finish watching the documentary on your own time. But right now, let's just talk a little bit about this issue. I want to begin on my end by saying a special thanks to the Tennessee Coalition for Better Aging, in particular, Grace, yourself, and Dr. Powers. The webinar series that you did back in the spring of 2021 was really formative in my research. And some of the research conversations that we had early on helped me identify not only the individual stories that you'll see in the documentary, but also some of the experts who were able to speak to these issues with clarity. So once again, I owe you a debt of gratitude on that. So thank you.
Well, you're welcome, Shawn. And thanks for mentioning the Reimagining Long-Term Services and Supports virtual meetings that we held in 2021. They really were the springboard for the coalition focusing on this issue and working with member organizations and stakeholders across the state to advocate on some real priorities that you highlighted in this segment. So thank you for that. And now I'd love to just ask you some questions about your insights from producing the segment. I know you interviewed family caregivers, social workers, and service professionals. Tell me about some of the things that really impacted you from those conversations.
Yeah, nobody's going to find this as a surprise. My biggest takeaway is something that a lot of people are talking about, and that's the fact that this deficits in long-term services and supports are really hitting the middle class hardest. And you saw that in nearly every story. I think the interesting thing for me is how we define the middle class, right? And that's anybody who's not financially either very well off or on the poorest end of the spectrum. And so that leaves, almost everybody in the middle. So unless you're very poor and qualify for Medicaid, or unless you're have substantial financial resources, you're going to be left on your own. And I think, when you look at even the first story that we were watching with Vicky, she's a working adult who is taking care of her parents along with her brother. And the strain of that hits home, personally, financially, emotionally. and there's little help outside of just family. So that was the biggest takeaway for me doing this, is that it's working families who are being hit hardest. Another thing was just when it comes to professional caregivers. There's a lack of professional caregivers because there's a deficit in the way we pay. All right, so I think if professional caregivers were fairly compensated, that might be a more competitive field, and we might be able to provide better care, a more consistent care in people's homes. But right now there's a real deficit there, and there's a shortage of caregivers. So those are just a few of my takeaways.
And I think it's worth noting that that worker shortage is an issue across the country. It's not just here in Tennessee, although we are definitely feeling it here in Tennessee. It is a nationwide issue that, and at the root of it, particularly in this competitive labor market, a lot of it is about pay for those workers when they can make more going to work for Target or Starbucks or Amazon.
Right.
So I think that is something we really have to address
Yeah.
in order to attract more people to that field.
And we touch on that later on in the documentary. But once again, even if there were caregivers available, the cost of caregiving is very expensive, and the average family may not be able to afford $21 per hour to have somebody come in and help. So, yeah, like I said, working families are really struggling right now to provide care.
And I think Vicky's story, which we did see, Shawn, really highlights the typical caregiver today is someone who's a working professional trying to juggle work and family care. Often they may be sandwiched between caring for young children, raising dependent children, and caring for aging loved ones. So it's a real challenge for those caregivers to try to maintain their own work and their own livelihood at the same time they're taking care of their families.
Yeah. And I hope it comes through in the documentary, but spending time, you were just about to meet Jimmy and Velma Jackson. You of course met Vicky. We got to see her with her parents. Spending time with the individuals, you really do get a sense of the toll that it takes, of the exhaustion. And not just exhaustion, but the people feel, exasperated, that they try so hard to exhaust the resources that they believe might be available to them, only to find that those resources aren't there, or there's a waiting list. So I hope that their experience really sort of comes through, and we make the case that there's a need for more resources out there.
Yes. Well, Shawn, I think you brought up something that is very striking as we've looked into this issue as a coalition, but certainly as your segment highlights, and that is that when we look at solutions, we need to talk about the broad middle class in addition to helping lower income families, that it's really a wide spectrum of families that need some additional assistance in order to provide care. Do you have any additional thoughts about that from the segment?
Well, I mean, when it comes to providing care for families, one thing, once again, we didn't make it there that far in the show, but we did do a story where we looked at 50 Forward's adult day services program. So here was an example, I think, where there is some hope, where there was a program that's a community-based resource, and it's much more affordable than both institutional care or home-based services, and it gives families a break, and it gives them a place to send their loved one while they're at work, for instance, and to know that they're going to get a meal, that they're going to be stimulated with interesting activities. So that's one example that I saw of a resource that does exist in our community for people that may occupy some place in the middle and need something for their loved one. I hope that answers your question.
It does. And I'd like to take a minute because we were cut short in viewing the segment. In addition to highlighting those community services like 50 Forward's Adult Day program, another thing that you did a great job of in this segment is highlighting innovations, highlighting the greenhouses. Bill Thomas and I believe it was the Ave Maria homes in Memphis. I wondered if you could take a minute just to describe that as a model of ways that different individuals and organizations are reimagining what long-term care can look like.
Right. Well, you know, Bill Thomas has a long history in working to reform long-term care, particularly institutionalized care. The Greenhouse Project was one of his earlier visions. It followed on the tail of the Eden concept. And these are both ideas that we create an atmosphere that is more like home. It's come up time and time again that when given a choice, older adults would rather stay at home. They don't want to go to the nursing home by and large. So what if we created a space where they did feel like they were at home, where they were, it was, for one thing, smaller, has a dedicated staff, everybody gets their own room. These are some of the basic concepts in the Greenhouse Project. And so Dr. Thomas made a really compelling point later on in the show. And he talks about, so what's the difference between operating a greenhouse and a conventional nursing home? He says, well, the greenhouse on average, give or take, costs about 10% more to operate. And why is that? Because everybody gets their own room. And he made the point that when builders are given a choice, and developers, they opt for, you know, a little bit more revenue. And so I think he made, you know, and he then went on to make the point that the greenhouse model was put through a stress test during the pandemic. And essentially what happened was they found that there was substantially fewer deaths and cases of COVID in greenhouse homes than there were in conventional nursing homes. And why? Well, people were able to go to their room. They were able to quarantine. They were able to separate. There weren't people grouped up in hallways. And so, you know, one thing that was really encouraging in New York Governor Kathy Hochul's State of the State address, she talked about a willingness to support nursing home conversions to greenhouses because the evidence that greenhouses were more effective in preventing COVID deaths was compelling. So I think, you know, on a state by state level, if state leaders see a compelling reason to change, that there's hope.
Well, that New York example is a great example of one state that is innovating and reimagining their long-term care. Are there any other examples that stood out to you?
Yeah, and this is one area that I wished I could have explored more in the documentary. As I've spoken to you about before, Grace, 30 minutes isn't enough time to cover every single issue, especially in something as big as long-term care. So I did have a chance to talk to some folks from other states. And so let's just talk about Minnesota, for instance. So I spoke with Lorraine Canadarud. She's Director of Aging Transformation for the state of Minnesota, and Carrie Benson, who's the Executive Director of the Minnesota Board on Aging. And I learned a little bit more about why Minnesota is ranked #1 in long-term services and supports by AARP. I wanted to hear directly from them, you know, what makes you stand out? And right off the bat, Carrie Benson, she pointed out that they have a history of legislative support. Back in 2001, they passed long-term care reforms based on a task force assessment. And the legislature passed that assessment almost verbatim. And she said, that was 20 years ago, but even as politics have ebbed and flowed, there's been consensus on long-term care. And why? Because it's been popular. And I've heard this said before, if change is going to happen, it's going to have to be because legislators hear from people that it matters, right? So in Minnesota, this legislation that supports long-term care and keeps it funded, well, it's been a win-win. And so that's one thing I learned from them, is there's that support. So the other thing I was curious about is this idea of public-private partnerships, right? And I knew that Minnesota had the Minnesota Long-Term Care Partnership, which is a public-private partnership around long-term care insurance. And I thought, well, here we're going to, find something interesting, find out what makes this great. Well, that's not what I found. In my conversation, it was described as mostly focused on institutional care. So it didn't do much to provide for home and community-based services. And it was kind of a clunky product with funds that are hard to access, and that it's not very viable for the middle class. Well, needless to say, that's not what I expected to hear, but I was happy for kind of an honest answer. So in Minnesota, they've been trying to innovate in other ways. I'm just going to name a few of them, all right, because I know that I don't want to run too long here. Right now, they're using Medicaid supplements to provide non-medical services to people in their homes. At the same time that they've been doing that, they've ran into some pushback from health plans for any more mandates. So, they're trying to utilize that, but I don't think it's a solution in and of itself. Another thing that's interesting is about 10 years ago, they started a public awareness initiative called Own Your Future. And as part of that, they did an actuarial study that was funded by the government. And that study was on a term life insurance policy that morphs into long-term care insurance at retirement age. So the example she gave me is, if I purchase $150,000 in term life insurance, I will have $150,000 in long-term care insurance. And it will only cost me about $9 extra a month to get that. So they've been doing research and development on a product such as this. But here's the catch. They are not in a position to actually offer this product. What they're counting on is a large employer to actually adopt a product like they're demonstrating and be able to bring it to scale. So it's this idea that's good in theory, and we'll see where it goes. I'm interested. I'm kind of at that age where I'm thinking that's the kind of product that I would be interested in purchasing. So I'm intrigued, but once again, it's still not anything that's actually been brought to fruition. To move on, I also talked with Dr. Mark Cohen. He's the co-director of the Leading Age Center at UMass Boston. And another individual who is just a wealth of knowledge on this subject matter, and I wish I would have had the opportunity to include in our documentary. He seemed most enthusiastic about the Washington Cares Fund. It's a first in the nation national social insurance program. So a quick breakdown. All W-2 workers contribute, and self-employed people can opt in, and it's 58 cents per $100 of income. And that provides $36,500 of long-term care for those who need assistance. And those who need assistance are defined as those who need three activities of daily, or who need help with three activities of daily living. Basically, that comes down to $100 a day for a year. So some may say that's not nearly enough, but as Dr. Cohen points out, it's far ahead of anything else we've seen out there. And according to literature provided by the state of Washington, it's estimated to save taxpayers $3.9 billion by 2052. Wow. So here we have an example of something that's concrete, right? This money is going to exist for folks when they need it. And that's more than we can say, well, for really anybody else. So
well, that's an excellent example, I think, and as I understand, that Washington state effort was a very collaborative effort in the state to come up with a solution and to have it passed by the state legislature. But knowing that they were able to do that, it serves as an interesting model for Tennessee and other states.
Absolutely, absolutely. I think so as well. And you know, if I could go charge back out there and do 30 more minutes on this subject, that's really where I would want to focus is I'd want to like look at the innovation that's happening around the country. The one thing that gives me hope is there are people who are working on this, who are thinking about it, who are reimagining long-term care. And it's easy to sort of get stuck inside of our bubble, but I think it's going to require looking outside in order to maybe figure out how to fix what's going on inside our own state.
Absolutely. And I think as you brought up that hybrid insurance product, I recall reading in the last AARP bulletin, there was an article about a couple in their 50s looking into long-term care insurance. And I know that's something my husband and I are considering as we're in our 50s now. And this advisor suggested looking at the hybrid life insurance long-term care policy. So it sounds like that is something that's available on the private market for individuals to purchase. And perhaps if it is, it's something we just need to provide easier access to the public and those who can afford it. It's not going to be everybody, but for those that can afford, it could be a pathway for your own future long-term care.
And the one thing I kind of learned about long-term care insurance in this process is that not all plans are created equal. So you do have to educate yourself. There are resources for that, and there are individuals who specialize in this. We did a panel discussion where we discussed long-term care insurance, and Dallas Souchet, she's president and long-term care specialist at Whitehall Benefits in Middle Tennessee. She talked about that, some of the reasons perhaps why only 7% are insured with long-term care insurance. And she's the type of individual who does do this work and could talk people through their options. So there are individuals out there doing that. But it is an area that people really do need to educate themselves on to figure out, A, if they even qualify and if it's something that's affordable.
Right. Right. Shawn, what gives you hope that here in Tennessee, that our leaders and that those of us really interested in this can work together to reimagine long-term care?
Yeah, I was thinking about this the other day. Honestly, Grace, folks like yourself give me hope. Folks, that are part of the Tennessee Coalition for Better Aging and Age Well, who are every day investing in this work and trying to figure out how to innovate, how to get the care to the folks who need it. That gives me hope. The other thing that I was thinking about this that gives me hope is, I think sometimes we underestimate what we're capable of. Back in 2014, I really did not see Tennessee, providing 2 years of free community college to all high school graduates. That, quite frankly, took me off guard, especially considering the fact that 2 years later in 2016, free college tuition was a topic of hot debate among Democratic presidential candidates, right? It wasn't even being discussed by Republican candidates. And here in a red state, we, provide 2 years of free community college. And, unless I missed something, I didn't hear a fuss. And why? Because it's good for working families. This provided some much needed relief. And so when I look at that, I say to myself, if we can do that, then I think that we can provide long-term care. Lawmakers are just going to have to see and be convinced by people that it matters to people. I read a little article from WGBH in Boston. It talked about, like, you know, why did this work? And one thing they pointed out was it wasn't framed as a populist message. Governor Haslam at the time framed it as a way to meet future workforce demands. Haslam said in the interview, he realized that by 2025, 55% of Tennessee jobs would require a degree or certificate. And at the time, only a third of Tennesseans had a degree. So he made the case a simple, you know, question of math and economic imperatives. So I think that we are capable of doing the same when it comes to long-term care. That gives me hope.
That gives me hope too, Shawn. And thank you for bringing up that example, because it's a wonderful example of innovation, and it also underscores the importance of how we frame these solutions. I think the same argument could be made about supporting family caregivers as being essential for supporting the workforce, because we know the majority of family caregivers are working or trying to maintain work. So that's a great insight to share. And I just want to thank you for producing this amazing Aging Matters segment. Encourage everyone. I know, I think Donna posted the link in the chat for that segment if you'd like to watch it following our webinar today. And Shawn, just thank you again for producing that, for being with us today and sharing the insights that you learned through that work.
Thank you so much, Grace. It was a pleasure.
Great. Well, I'm going to do my best now to get us back to our slides. So if you'll bear with me for just a minute. I'm now very pleased to welcome Lance Iverson with the Comptroller's office.
Well, hello.
Hi, Lance. I'm going to give you a brief introduction and then turn it over to you. Lance is a legislative research analyst in the Office of Research and Education Accountability in the State Comptroller's office. He has worked in Tennessee state government for almost 15 years, with most of that time focused on the administration of state agency finances. So Lance, the floor is yours, and we look forward to hearing about the long-term care report and some exciting announcements that you'll be sharing as part of your remarks.
Yes, great. Well, again, my name is Lance Iverson, and I should state at the outset that our office was asked to update a 2017 report on long-term care trends in Tennessee, which resulted in a written report that was released to the public 2 months ago. Today, I will present a summary of that report. I'm standing on a number of people's shoulders as I make this presentation to you, especially the lead writer of the report, Kim Potts, a co-writer, Cassie Stinson, the director of our office, Russell Moore, and Comptroller of the Treasury, Jason Mumpower. So first, the demographic backdrop. The number of Tennessee seniors aged 60 and over is expected to increase by 30%. From 1.6 million in 2020 to 2.1 million in 2040. Maybe even more important from a public policy perspective, the number of seniors aged 80 and over is estimated to double during this time, from about 260,000 to 521,000. This demographic reality will create greater demand for long-term services and support programs for Tennessee seniors. Now I'm going to give an overview of the 3 programs Tennessee state government operates to support low-income elderly Tennesseans. 1, TennCare Choices, a Medicaid program. 2, Options for Community Living. And 3, the Older Americans Act program. The giant of this group, though, is Choices. In 2008, the General Assembly passed the Long-Term Care Community Choices Act to rebalance long-term care by expanding the use of home and community-based services, HCBS, to fit alongside nursing facility care in order to provide more choice at lower per-person cost. Eligible seniors for Choices fall into one of 3 categories. Group 1 receives nursing home care. Group 2 receives HCBS up to the cost of what their care would be in a nursing home. And Group 3, for people at risk of needing nursing home care if they are not provided with some in-home assistance. all choices recipients must meet certain income and medical requirements. For the first few years after Choices launched, Tennessee experienced significant enrollment growth for HCBS, but rebalancing from nursing facility care to HCBS has shown little to no change since fiscal year 2015. This chart shows the number of people served that was represented in percentage terms in the last slide and breaks out HCBS into the Choices Group 2 and 3 levels. Breaking things out this way allows us to answer why there have been little to no change in the split between nursing facility care and HCBS since 2015. The red line at the top shows the decrease of Choices recipients in nursing facilities over the years, which was expected to occur with the expansion of HCBS. In Group 2, shown by the gray line, enrollment increased by about 16% between 2015 and 2020. But for Group 3, the broken blue line, enrollment decreased during the same period by about 63%. So Group 3 is where the action has been, as its enrollment began to decrease after a change was made to income eligibility in 2015 that restricted Group 3 to people receiving Supplemental Security Income, SSI. Long-term services and supports are expensive in general, but nursing facility care is the most expensive. It is less expensive to the state to provide support to people to help them stay in their homes for as long as possible. As this exhibit shows, nursing home costs not only exceed those for HCBS, but are also rising at a faster growth trend. Although the types of HCBS available to recipients of both Groups 2 and 3 are generally the same, services provided to those under Group 2 are more numerous because Group 2 recipients qualify for nursing facility level of care, while Group 3 services are for those that are assessed only as at risk of requiring nursing home care. A second program I will discuss is the Options for Community Living program, which was created in 1999 to serve Tennessee seniors who do not qualify for long-term care services under Medicaid. Options is administered by the Tennessee Commission on Aging and Disability, TCAD, and through the 9 area agencies on aging and disability, the AAADs. You can see services included in the program here on this slide. The annual cost of options per recipient is generally capped at $5,000. Due to the COVID pandemic, the annual cap for services has been temporarily increased to $8,500. In FY20, expenditures averaged approximately $3,300 per individual, with about $9.3 million in state expenditures. Options presently maintains a wait list. In FY21, 4,145 people were served, while about another 4,000 were on the wait list. The third and final program I will discuss is the Older Americans Act, the OAA program, that provides services designed to promote the independence of seniors age 60 and over. The services shown on this slide are the direct OAA services to individuals comparable to the 2 other programs we just discussed. TCAD develops a state plan within federal program guidelines to set priorities for the use of the funds and distribute funding to the state's 9 AAADs to carry out the programs across the state. The OAA is financed with a combination of state and federal funds, but the recent federal share has been about 90% of the funding. In FY21, OAA expenditures totaled about $21.8 million in federal and $2.1 million in state dollars. In FY21, 24,000 people received direct support services under OAA. Tennessee has maximized its match for this program, so it is unlikely that the amount of OAA services provided to Tennessee seniors or the number of recipients of those services will increase in the near future. This chart compares the state's programs that I've just described in terms of their average annual per person cost. These programs can be thought of as a continuum of services for Tennessee's low-income elderly population, with the most intensive services at the left end and with decreasing gradations of service levels and costs as one considers the other programs on the continuum. Public opinion surveys suggest that seniors prefer to remain in their homes for as long as possible. Services for at-risk seniors such as Choices Group 3, the Options Program, and certain OAA services are designed to save money in the long run by delaying or even avoiding the need for a senior to enroll in higher cost Choices Groups 1 and 2. Some people who might have been eligible for Group 3 under pre-2015 income requirements, but are no longer, may have sought assistance under Options and OAA, but these programs continue to have wait lists. Other people may be residing in unlicensed residential facilities, which has become an issue of increasing concern in this state. We are pleased to report today that multiple policy considerations listed in our report were adopted in legislation and appropriation of public money passed by the 2022 General Assembly. Most significantly, Choices Group 3 eligibility rules will be relaxed on July 1 to provide services for an estimated 1,750 people at a cost of about $20 million in state funds and $39 million in federal funds. Almost as importantly, the entire waiting list for options is to be eliminated through the appropriation of $10.4 million state dollars. Reimbursement rates paid to providers for options program services were also enhanced at a cost of $1.25 million. This was done to be an approximate parity with the rates that have recently been increased for Choices HCBS providers through the use of temporary federal pandemic relief funds. These rate increases are to mitigate the issue of low frontline worker pay. However, there are 4 items left for further discussion and consideration. First is a rather technical question related to the types of community-based residential alternatives that are paid for by Medicaid through TennCare. Second, as the extraordinary COVID relief funding to TennCare and the OAA programs runs out by the end of 2024, the question of replacing that lost funding with state funding should be considered. Third is the issue of unlicensed residential facilities. TCAD was asked by the governor to produce a detailed report about this issue. Our report provides a summary of that report and includes suggested actions the state could undertake to close existing unlicensed facilities and prevent the opening of new unlicensed facilities. Fourth is the critical issue of frontline workers' pay, a perennially discussed issue that we follow up on in our report. Public Chapter 1138 establishes a task force to report on this issue to the General Assembly with recommendations due by December 31, 2023. However, given the reality of the price inflation we see today, this pay issue is a continuous challenge, and it can be especially acute as applied to the decisions made by people that have careers providing supportive services for seniors. As general costs go up, these workers will often make a move to jobs that pay more money. The state can expand program eligibility more broadly, but to get the intended effect, there must be the direct care staff available to do the actual work. That concludes my presentation, and I want to thank you for your time and attention. The full legislative brief and its executive summary are available at the website listed on this slide. And just regarding the screening of the Aging Matters documentary, it's really good. I encourage everybody to watch it, and we certainly watched it as staff in our office as we prepared our report. Thank you.
Thank you so much, Lance. I'm happy now to introduce Amy Harris. We felt like on this panel, it was really important to have a family caregiver share their personal perspective. Amy has worked in the field of special education her whole career until she left full-time work 2 years ago to help with her mom. She is the executive director of Achilles Nashville, a nonprofit adapted sports group that supports athletes with disabilities. Amy has 3 girls and 5 young grandsons, all who live in Nashville. One of her daughters has cerebral palsy and lives at home. Amy is the primary caregiver for her mom, who has severe Alzheimer's disease and needs total care. Amy, thank you so much for joining us today.
Can you hear me okay? Great. I really appreciate this opportunity to be on this panel to share a little as a family caregiver My role as a family caregiver has changed over the years as both my mom's living situation and her needs have changed. In 2009, my father passed away. My parents were both living in Savannah, Georgia, and life as I knew it dramatically changed. My mom already had Alzheimer's then. She hasn't known me for over 15 years, and yet she is and has been totally dependent on me all that time. My brothers, sisters, and our children moved Mom into a facility that's in my neighborhood in Nashville. It's literally 2 buildings away from where I live. And for 11 years, we thought that was a pretty ideal situation. Mom was in assisted living for 6 years. And then because of her greater needs with her Alzheimer's, she transitioned to the skilled nursing program within the same facility. My children and I all live in Nashville, so we got to see my mom all the time. We ate with her, we took her out, we did family things in and out of the facility. And the care that she received there was really good. Being so close to the facility and being on site so much, we were always in touch with her daily routines, who her caregivers were, what her needs were, and we were actively engaged with all levels of her care. And then came COVID. So during COVID, from March 2020 until October 2020, families were not allowed inside the facility. We did have them move Mom to a room that had an accessible window, and I would go and tap on her window every day and hope that she would acknowledge me. It was really heartbreaking to see Mom alone in her room, often in her bed, despite the fact that she could use her walker with standby assistance. But she was isolated, as residents often were during COVID, and we were helpless and hurting. Our ability to care for our mom was taken away. And without the support of families, the nurses and techs within the facility were also stretched to the max. So in late 2020, my neighbor told me she was considering moving within the year. My family agreed that if we could negotiate with her to move sooner, that we would buy her condo for Mom and we would provide the 24/7 care that she needed. So it was much sooner. 6 weeks later, I found myself leaving my full-time career job. Along with my children and their spouses, we were frantically pulling up carpets, painting, laying flooring, installing safety bars. Mom came home on October 6th. We had a dining table and a hospital bed in her 3-bedroom condo. That was it. We did have all the medical stuff, pull-ups, chucks, sanitizers, wipes, all that kind of stuff. Thankfully, my niece, a set designer in California, ordered all the furnishings we would need to start out. Within the next few weeks, things started arriving: couches, chairs, TVs, beds, everything. Mom's house was starting to take shape, and with all the kids, the grandkids, the great-grandkids, the dogs, the cats, everyone in and out, it was also starting to feel like home. I was in church with my mom Easter Sunday 2010, and in the bulletin was a verse. This verse has since shaped my perspective on the care of my mom. It's short, and I'm going to read it to you. It says, "There comes a time in our lives when our parents or our grandparents become too old or sick to care for themselves, and they stretch out their hands to us. It becomes our task to dress them as they once dressed us, and to take them where they don't wish to go, as they many times took us where we didn't want to go. It's part of the coming of God's kingdom. The last are first, and the first are last. The children become the parents, and the parents become the children. We glorify God by the manner in which we answered the call to serve those who once served us." That verse is my big picture view. I am reminded of the parent my mom was to me and my siblings, and how we were loved so unconditionally. How could we be any less to her? I want to share with you a few of the pros and cons of having Mom in her own home. I think that we want to build on, when we think about reimagining what quality home care can be, I think we want to build upon the pros. And then I also think that we want to look at the cons so that we can focus on improving. So some of the pros with mom, she's definitely more comfortable around her family, whether she's, in a group or not. She's clearly prefers her loved ones. Since we see her every day, we certainly have a better feel for what she likes and doesn't like. We have more familiarity with her moods and habits. Alzheimer's disease changes over time, and it's easier for us when we're with her to be able to spot and accommodate those changes. We can devote the time that she needs to eat and drink. It takes a good 45 minutes, breakfast, lunch, and dinner to feed my mom. She lost 35 pounds during COVID, and I'm sure that's because they just didn't have the time to send someone, and we understand that. She's never alone or far away from someone during the day or night. We keep her safe. We can focus more on her needs versus in the nursing home where others demand, it's that whole idea of group care, attention. Some of the cons, I think, we do miss the interaction with others, and we do miss being part of a larger group. There aren't as many organized activities. We don't have the symphony coming in at my mom's. We don't have, the music activities set up, the art activities that they have set up in the centers. It can be more stressful on the family members taking direct care versus just visiting the assisted living facility. And I think for some family members, that can be too great. And then I think the cost of care. For us, I watched some of these slides. I'm like, I don't know where these people are. We pay upwards $200,000 a year, whether it was in the facility or in our home. And that is out of pocket. And that does not cover, that is only counting the caregiving. That is not counting the other supplies that are a part of that. So in reimagining care, I think there's a couple of questions that should be at the forefront. How can we make environments meaningful for the person, the individual? How can we bring in the things that matter to the individual? For example, for my mom, she was an artist. She was a gardener. She loved the outdoors. She was a seamstress. She was a cook. She was active with charities, with philanthropy. She was a world traveler. So how do we make her environment rich with the things that were important to her? And then how do families and individuals define quality of care? What matters to them? And then I think, how do we provide support for the family members who are caring for their loved ones? Our family, I think, is very fortunate. While I cover several shifts during the week, we have a great team from an agency, Blakeford at Home, that helps support the 24/7 care that my mom needs. We're also connected with and get support from hospice. While I'm able to oversee the day-to-day routines, my brother manages all of the finances on his end. My mom has a big family that loves her and visits her often. We're all part of a team that are working together with the providers to assure that her needs are met in a loving, supporting environment, her own home. Thank you.
Amy, thank you so much for sharing more about your perspective as a caregiver and how your advice too for how we can better reimagine long-term care. Thanks so much for being here with us. At this time, I'd like to invite Mia McNeil, Executive Director of AARP Tennessee, who brings her deep understanding of effective advocacy and community outreach. She joined AARP Tennessee in January of this year, and in her formal role, she was Director of Government and Community Relations at the University of Michigan, Flint. Mia earned her law degree from the Thomas Cooley Law School and a bachelor's from Tennessee State University. So welcome, Mia.
Thank you so much, Grace. So as all of you heard from the Comptroller's updated report, we can expect that there is going to indeed be an increase in our senior population between 2020, last 2 years ago, and 2040. And because of that, we know that that is going to be a staggering increase, and it really underscores the urgency for preparing for our long-term care system. Now, our AARP research is constantly fielding surveys, both nationally and locally, to measure the needs of the 50-plus community, especially as it pertains to long-term services and supports. And that is the data that drives our work and explains why we work to create age-friendly communities, support family caregivers, and advocate fiercely at every level for policies that make a difference. Next slide, please. So in late 2021, AARP conducted a survey of people over the age of 50 and registered to vote in Tennessee. And its findings reflect a need and desire to do more for our aging population. For example, there was overwhelming support for policies that help people age in place, support family caregivers, and make it easier for people to receive remote health care. There was a clear majority of support for protecting jobs of caregivers and providing time off, and that is either paid or unpaid for caregivers, and unanimous support for people being able to choose to receive long-term care at home. If we don't improve the full scope of long-term care, Tennessee's seniors confront a system that lacks good choices, putting their independence and well-being at risk. Long-term care facilities cannot be the only way we care for our seniors. Nationwide, only 33% of Medicaid and state-funded long-term services and support spending goes toward home and community-based services for older people and for adults with physical disabilities. Yet our research shows that 95% of Americans want to be able to age in their home. So how do we move that needle? Next slide, please. AARP is working with communities across Tennessee to plan and implement age-friendly measures to make cities and towns more livable, not just for older residents, but for everybody. So age-friendly really means making service and infrastructure improvements that impact livability. And it breaks down like this: access to transportation options for those who no longer drive, affordable housing with universal design elements such as zero step or wider entryways to accommodate wheelchairs and walkers, outdoor spaces like safe streets, parks, and accessible buildings, social inclusion to reduce isolation, opportunities for people to work or volunteer in the communities that they're in, access to communication and information in a variety of ways, and availability of adequate health services. So when I say AARP, and that includes all of our wonderful volunteers, but when I say AARP is included in community, we're not only focused on just the community, but those organizations, the community-based organizations, so that we can help push their initiatives forward. For example, working with the Tennessee Commission on Aging and Disability to help older homebound seniors get the COVID vaccine at home, or try to find transportation so that they can get the vaccine, or supporting volunteer driver programs at low or no cost so people can go to medical appointments or go do their grocery shopping or even get their hair done, and providing grants to organizations who address food insecurity. Next slide, please. Currently, the focus of this work is in partnership with communities across the state who have committed to improving livability as members of the AARP Age-Friendly Network. Now, as you'll see from this map, the group is diverse in every way, geographically, population, demographically, and they all share a common goal of wanting their residents to age in place. Next slide, please. There are about 48 million individuals providing unpaid care to an adult family member or a friend in the United States. That accounts for $470 billion worth of unpaid care. Tennessee is the home to an estimated 990,000 of those people. Here are some Tennessee-specific AARP research figures. You'll note here on the slide that 54% of current caregivers are also working full-time. And nearly 8 in 10 of caregivers report having routine out-of-pocket expenses related to looking after their loved ones. And it usually averages about $7,242 per year. 74% of the caregivers experience emotional stress, and perhaps not surprisingly, 81% of those surveyed were supportive of time off work, paid or unpaid, for caregiving purposes. Next slide, please. So AARP is fully committed to supporting family caregivers, and we have a wonderful website that is dedicated to family caregivers, which has helpful articles and tools and free resources that can be used. And you can find that at aarp.org/caregiving. And we have a fantastic document called Prepare to Care, and it's a guide to help people build a care team and fully support the needs of their loved ones. I would also encourage you, if you are a caregiver or know someone who is, to utilize our hotline for family caregiving. And that phone number is 877-333-5885. It is available Monday through Friday from 7 a.m. to 11 p.m. Eastern Standard Time. Additionally, with our advocacy, we are currently encouraging Congress to support a credit for caring bill, which would provide an up to $5,000 federal tax credit for eligible working family caregivers. And at the state level, we help secure funding for a respite care pilot program, which is the Bowden Memorial Act, that will hopefully lead to a permanent respite care program. Next slide, please. So how do we reimagine long-term care? Well, here are a couple examples of the recent progress being made to solve some of the home and community-based services challenges that Tennesseans are facing. During the recent adjourned session of the Tennessee General Assembly, AARP and our partners helped to ensure $9.7 million from the state budget for the options program and $1.2 million in recurring funds for home and community-based service care workers, both which will allow Tennesseans to receive services in their home. And through the pandemic, we learned how important a technology infrastructure is to aging in place. So telehealth was embraced by providers and allowed people to receive care through technology. Of course, broadband still remains a hurdle in some places, but we're working hard on expanding broadband access across the state. And state lawmakers approved an extension of the policy that allows healthcare providers to provide medical services through telehealth. We will continue to urge more funding and support at the national and state level for home and community-based services. As you can see, progress is being made, and the fight goes on until we can adequately serve the long-term care needs of our neighbors. What it really boils down to is this: after a lifetime of hard work and contributing to our society, seniors deserve to live with independence, security, and dignity. And I'll pass it back to Grace.
Mia, thank you so much. And I want to thank all of our panelists for being part of today's program and the important information and insights you've shared. At this point, I wanted to just draw your attention back to 3 priorities that the Coalition for Better Aging will continue to advocate for. That is addressing the direct care worker shortage, improving support for family caregivers, and expanding home and community-based services. We invite you to join our efforts, and I love honoring the memory of our beloved nonprofit colleague, Tolu Quinn, who said, "We need to imagine what is possible and then get busy doing our part to make it real." Now I'd like to invite Coalition for Better Aging Secretary Donna DeStefano, Assistant Executive Director of the Tennessee Disability Coalition, to wrap up our program. And Donna, I know we're running overtime, and Thanks to those of you who are sticking with us. Donna, if you will wrap us up today.
Okay, thank you. So I think since we are running over, we do have a few questions that people have asked. What we can do is we can take those and we'll get those answered and send them out in some follow-up materials. How does that sound to our panelists? Since I don't want to rush those, I want to be able to do a good job on that. Okay, thank you. And thank you all panelists for being here today, for sharing all the information that you did. We have already gotten a comment saying that it was an excellent panel speaking to a variety of needs in long-term supports and services. And I thank you all for your flexibility and timing and how we did things, you know. Haven't we learned how to all be more flexible in this virtual world? So with that, so thank you very, very much. We hope that for the folks that are participating, thank you for coming and joining us. We hope that this has inspired you to get involved, to share your story and your ideas for reimagining long-term supports and services. We have put the link to the Aging Matters segment on this last slide, and we will get you the slides too with the materials that we will send out. Please get involved with the Coalition for Better Aging. Share your stories. Visit our Coalition for Better Aging website, coalitionforbetteraging.com, or email us. TN Coalition for Better Aging at gmail.com. I will also say in brief, there's so much that we want to say because we have lots, but there are some things that are really key to all of this and everything that everybody said. And those things are that your voice matters, that you're telling your story to people, to legislators especially, is critically important. You heard some of the things that the legislators passed this year in Tennessee that we're asking legislators at a federal level to pass. We need to hear from you. They need to hear what those things are, because the folks in Tennessee heard you and passed monies for the option program and made sure to have monies to open up the group 3 of choices. That's important. So taking the facts, taking your stories, bringing them to people. You have the Comptroller's report now to feel free to use that. And you know, the legislature is, they are the ones to pass the laws, to pass the budget. They have the purse strings. So use them, get to know them. Anyway, so the other thing I really want to say is if you want to comment on the 10 Care for the Choices Group 3 opening, you can comment to them by July 8th, and we'll make sure to get that information to you too. But again, thank you very much, and come join us. So Grace, I guess we will conclude with that.
Thank you all.